podcast, Lane went down to the Adam Vital Hospital to meet with Professor Andreas Imhoff and learn everything about orthopaedic sports, medicine and rehabilitation. So let's take a look.
So it's that time of the year again where we all want to transform our bodies and look different and feel different. So what tends to happen is we get in the gym and we work out like crazy and we cause ourselves an injury. Then you're going to end up somewhere like here, the Adam Vital Hospital in Garhoud, the Centre of Excellence for Orthopaedic and Sports Injuries. So I've come to meet one of the most world-renowned leaders in this field in sports medicine and reconstructive surgeries. His name is Dr. Imhoff, and I'm going to talk to him about how we can actually reduce this from happening and avoid coming here to see him. So Dr. Imhoff, it's a pleasure to meet you. I've come here very inquisitive, but also I have an injury myself. So I would like to know a little bit more about how we can delay sports injuries, and tell me a little bit more about what's the most common sports injury that people face.
The most common and the most sports injuries we see are in the shoulder, that's quite often, knee, ankle and elbow. Because young people, when they do sports, they don't always think about their joints, and let's say the people who throw a ball, like basketball, handball, something like that, baseball, they injure their shoulder quite often because they have so high velocity motions. Like when they throw a ball like this, they get injured, but they don't feel it immediately, it comes later. In the knee joint, you know, all famous football players, almost all have some small injuries because they don't think about their joint. They just try to bring a ball and to win. You know, prevention is a wide field. Prevention means it starts with education. The trainer, the physical trainer, the personal trainer, they should do some kind of prevention, showing them how to do it, to avoid this. When you start skiing, you go to a ski school. If you start playing, you don't go to a school. So that's why we have more injuries with football players and with skiers. That's the problem, we don't have schools for that. Actually, we would need.
You're here for only a short time at the Adam Vital Hospital here. We're very privileged to have you here. So I brought a friend of mine here as well, who's also got an injury that we want to speak to about and see what you think about that injury.
Doctor, I believe I have one of the tendons in my biceps got cut off while I'm doing my biceps exercise on one of the days.
We know that one part of this biceps is broken, that ligament goes into the shoulder, it's ruptured inside, but the other one is still here. It happened 2 years ago. Now it's a little bit a long time. Maybe we should think about how can you prevent something will happen on this side. Maybe this is important for you. And you see now, this is a normal muscle and all these tendons are going inside. So you can do training, and when you do the training, you have two muscles, anterior and here and here. So you should do training both. Otherwise you get an excessive load and this tendon here inside will be squeezed and will break. Can you remember when you played football, when you did some specific dancing exercises, what happened? Because now we can treat that, but we also should think about prevention. Prevention means that we should avoid this excessive load from the tendon to the bone. This is what we have to do now. Healing and prevention together. Here, this ligament starts here. Here's the kneecap and goes down to this point. It hurts here. Correct. And now you can do some strengthening exercises, like lift your leg like this here and go back. Because of this, you will not use your muscle normally. And that's why it starts hurting around here and here. So that's why the training for you needs more training here in front and the back together. If you have stronger muscle here in the backside, you can bring that back the lower leg and then you can unload this part. And this will reduce the pain.
I feel happy, confident and fit now that I have seen one of the most world-renowned leaders in this field. I can't wait to go and do a bit of exercise now.